Thank you. Thank you. Yeah. Thank you, Mary. Well, thank you for coming. And I told somebody out there who was, thanking me for the work, and I said, you can have a leader, but if the leader has no followers, the leader is toast, right? So thank you to you for being the support for our organization, for my efforts at the Capitol, for coming out, for coming when I call, for coming when Jenna sends you something, for sending in a letter, all the things that you do, for supporting us financially. Because otherwise, as I said, you can lead, but it's not much of a leader if you don't have any followers. So thank you, because really, it's all about you. So I have a list of special thank yous just before I get going here, and I don't want to miss any of them. So thank you to our sponsors, our donors, our board of directors, and our volunteers. This evening would absolutely not have been possible without them. Thank you very much. And I want to give a special thank you to Jenna Miniger, our staff member, because she worked like crazy to get this organized, and it was really, really amazing. And then along with her, is Crystal Queering, who is our volunteer co-coordinator, who spent just weeks and weeks working. So hands off to them, wherever they are. Okay, and thank you to the folks who are out there, the display tables. This gives you an opportunity to see a lot of the other conservative, hardworking free market organizations around the state and working at the Capitol, so I'm glad that they came. And I also want to thank Tom Emmer. Yes, I was going to say the 12 hours was just a little bit extravagant. When Sue called me and she said, Twila, my children are the most important thing. I said, I know, Sue, what does this mean? So thank you, Tom, and just for stepping in for Sue and being a great MC. And thank you to Representative Wardlow, because he's, probably enough was not said about him, but I don't know if you know that the amicus brief was his idea, as I recall, and he helped and was instrumental in starting the conservative study group in the House and the Republican side, and so there's lots of things. I think, he's very strong. There's a few really strong freshmen, and it's really good to give them all the support that they can have, because they're kind of in a lion's den. Let's just put it that way. And thank you to the Minnesota legislators. I know they stood up, but I want the ones to stand who were the authors and the co-authors of the Stop Obamacare bill. I want them to be recognized. Anderson back there, Mary Franson, Gretchen Hoffman, and Doug Wardlow. Thank you very much. So finally, thank you to Jonathan Emord for coming to Minnesota to talk about the rise of tyranny and to show us your plans for paving the way back to liberty. I'm just pleased he could be here with us. I heard him give a presentation about his book, and he's gone on now to have an Obamacare lawsuit and everything, but I was so amazed with the presentation. I think you will learn things you never knew. And what I'm really excited about is that he's going to talk about the way back to liberty, and that's one of the reasons that we called it the way back to liberty. So thank you to all of these people, because without you, this night would have been nothing. So now, before Jonathan comes to speak, I'm just going to talk to you about us, about our organization, Citizens Council for Health Freedom, where we have been and where it's going. I'm happy to report to you that we have made great progress this year. There are 5 key successes. And before I name the first one, let me just draw your attention. Know what this is? This is the Obamacare bill, and which is now, of course, the Obamacare law, and we've got it all dressed up because it's a present we're going to give back to Obama. Okay, so success number 1, stalling Obamacare. Last session, with the help of concerned citizens, lots of you out here, we stopped the Obamacare health insurance exchange from becoming law in Minnesota. We put out a call, and 70 people showed up for a hearing to oppose the bill, and I guess you could say that was about it. There were a few other tremors, but that was really the end of it. Then during the special session at 10 o'clock at night, I discovered some health insurance exchange language in the HHS bill. And what's the first thing I did? Took out my cell phone. Doug Wardlow, Representative Wardlow, who you just heard from. I said, there's exchange language in the bill. And he activated the leadership in the House, and they issued a brand new bill with a brand new number, brand new signatures, and thus they did not sign it until well after midnight. And so now this means that the governor has not one word in law in Minnesota to let him build the health insurance exchange he wants to build. Success number 2, baby DNA. 8 years ago, we discovered that state governments are storing and using newborn DNA blood spots for research without parent consent. Our baby DNA efforts so far have led to parent consent laws in Texas and Oklahoma. And last March, the Minnesota Supreme Court heard the case of 9 Minnesota families who, with our help, sued the Minnesota Department of Health. We expect a ruling any day. They come out on Mondays, and I'm kind of hopeful it'll be next Monday. But hopefully you'll all hear about it. I was also invited to give a speech in Utah early this year to a large group of researchers from around the country who do not support our position on baby DNA. They don't support parent consent for the storage and use, the government storage and use of DNA. So despite some initial opposition from the group to me being invited, at the end, the organizers told me, they came out and told me at the end of the conference that they all agreed that the conference wouldn't have been the same without me being there. So that was fun. Then this summer, Nature, the international science magazine, covered our baby DNA efforts in a 3-page article called A Spot of Trouble. So all around the world, people read science magazine, so it was great to have that kind of coverage. And then finally, as a result of our efforts, the federal government has given a 5-year, $1.1 million grant to a researcher to explore public attitudes about government storage and use of baby DNA. Of course, they don't call it baby DNA. They call it newborn dried blood spots. They don't like the fact that we call it baby DNA, but they actually did a study and found that parents said, we'll call it DNA because that's what it is, right? So, and because former Representative Tom Emmer is here, I do want to thank him for helping us in 2009 stop the bill that the health department was going to use to take ownership of all DNA that they had and DNA into the future. Tom and I were on the Glenn Beck show together, and Tom had some DNA ownership bills and caused some hearings, and well, you could just say that was the end of it. So thank you very much, Tom, for really being instrumental. So I think you'll agree we succeeded in moving this important issue into the public awareness and toward parent consent everywhere. Success number 3, radio syndication. 9 months ago, as a result of your generosity, last time we had this annual event, our Health Freedom Minute radio program went national. It now has about 3 million listeners on 158 stations in 37 states. One woman who's here told me that she wakes up every morning, turns on the radio, and says to herself, "What will I learn today?" I love that. So with your help, we can sustain the program and raise enough money to put the Health Freedom Minute on Rush Limbaugh twice a week. That's my goal. Success number 4, communicating our message in print. I'm going to mention just 5 efforts within this category. First, our email subscribers to the monthly Health Freedom Watch newsletter increase with every publication. And you got the hard copy one on your seat, but we have an email one as well, and that one just keeps rising in subscribership. And there is a place to sign up for it out on our table. Second, my report on the actual requirements of the health insurance exchange law brought a congratulatory email from a senior attorney at the conservative Goldwater Institute in Arizona. That felt like a feather in my hat. Third, we've created an occasional publication called the Health Regulation Alert to explain certain proposed federal regulations and to provide instructions for public comment. I can say it's working. Lots of people have responded and sent to the federal government their comments against at least 6 proposed regulations that we have highlighted in this. And usually, the regular public is not talking about regulations, and you're going to hear a whole lot more, I think, about rules when Jonathan gets up here. But these are things made without elected officials. It's just like they're writing their own law, and usually the public has no idea it's happening, and it's our goal to give you some input and to make a difference and start to change things. So fourth, the Star Tribune published my op-ed opposing their support of the health insurance exchange. I was surprised, but they gave it an enormous title and a prime spot on the page. And fifth, we began sending commentaries around the country on key issues. Our op-ed against the Obamacare exchange was published by nearly 20 newspapers around the country. It was also highlighted in Kaiser Health News, which is read by policy and industry folks everywhere. So, success number 5, national impact. Minnesota is considered a leader in healthcare. Unfortunately, too often in the wrong direction when it comes to policy. But we are using our experience here, above and beyond the baby DNA issue, to try and help other states combat Obamacare and those kinds of issues. So for instance, we held our first Capitol Hill briefing in Washington, D.C. for a room full of congressional staffers. And we talked about the prevention provisions in Obamacare in a conference that we called Prevention and Wellness, Who is Responsible? I think you'd find it very interesting, and you can find it online on YouTube. I have also just been invited to join the advisory board of the National Patient Doctor Medical Association headquartered in Virginia. And closer to home, we recently helped Wisconsin groups defeat an Obamacare bill. And one of their main leaders is right over there in the blue. And she called me and she said, essentially, help. And a bunch of us came together, and it was great to just see it go down. And then in a similar thing, North Dakota just said today that they aren't going to move forward with the exchange. I heard from Gretchen Hoffman that the governor said he's not going to move forward with the exchange, and we had helped a member of the legislature there by analyzing the entire bill and then giving her points that she could use to argue against it. So these are victories against Obamacare. Now, add our move to a new office space on October 1st. That was quite the ordeal. And you might say that we've had a busy and productive year. And so as I look forward to 2012, you can be sure that we will continue our efforts to protect baby DNA. We will also continue working to restore patient control and consent requirements over private medical records. This is key to protecting patients from healthcare rationing. As I like to say, he who holds the data makes the rules. Any country that wants to control its citizens gathers data on its citizens. So you can also be sure that we are not going to give up on repealing Obamacare. This is not negotiable. America will not be free until Obamacare is repealed. Thus, we are committed to stopping its implementation in Minnesota and elsewhere. And to that end, 2 days ago at the first meeting of the Governor's Health Insurance Exchange Task Force, I stood up during the public comment period and asked the Commissioner of Commerce if the Dayton administration has legislative authority to implement an exchange. Commissioner Rothman hemmed and hawed and skirted the issue and thought he was done, and I said, but you didn't answer my question. And then he said, I answered the question the best way to answer the question. So he refused to say yes or no. Yes would have been easy. So obviously the answer is no. Thus, we achieved a real win last session by stopping the exchange, and we will continue to work with concerned legislators to stop Dayton's plan or anyone else's plan to establish any kind of government health insurance exchange. Amidst all these efforts, I want to take this opportunity to share with you a new emphasis for Citizens Council for Health Freedom. As I said, repealing Obamacare is not negotiable. It's got to go. But its repeal won't be enough to cure what ails healthcare in America. We need to restore the mission of medicine in healthcare. It may not be obvious to everyone, but the patient-centered mission of medicine is being consumed by the business of healthcare. The mission is being assailed by laws, rules, regs, health plan contracts, negotiations, mergers, and mandates. It's being run over by HMOs, PPOs, and ACOs, by bundled payments, government reporting requirements, pay for performance, and hundreds upon hundreds of restrictive regulations from federal agencies like OSHA, HHS, FDA, and CMS, to name a few. I'm a registered nurse. I can assure you that the items I just mentioned are not going to help you get the care you need, and all of them will make care more expensive and less accessible. Today, we have hundreds of thousands of wonderful doctors and nurses whose mission to help and heal is increasingly burdened by the expensive, intrusive, and time-consuming regulatory business of healthcare. Doctors are being forced to follow insurer and government-issued treatment protocols or risk loss of income. Nurses have become experts at checklists. Clinics have more administrative staff than doctors, and patients are being forced into intrusive, interoperable electronic medical record systems to enable the tracking of their doctor's every move. These regulatory business practices are negatively impacting the patient-doctor relationship. They are changing the focus of medicine from patient care to paperwork. For example, when you walk into a clinic, what's the first thing you hear? Are you greeted with, "Hi, how's your day going?" Well, maybe. But if you're like me, all too often you hear, "Sign in. Can I have your insurance card?" And if you refuse to sign those HIPAA forms, as we suggest, or you refuse to answer detailed personal questionnaires, or if you refuse to let them vaccinate your child, you might be chastised, argued with, or even turned away like the people that call our office. As president of Citizens Council for Health Freedom, I am committed to using our resources and efforts to revive, revitalize, and restore to healthcare the patient-centered mission of medicine. This is no small endeavor. This will require educating the public, enabling new systems outside of current structures, and empowering patients with their own dollars and their own lifelong real insurance policies. This will require acknowledging patient ownership, control, and privacy rights, reducing or ending entitlements while protecting those dependent on them. This will also require rethinking today's medical education, opening new markets for insurance and healthcare delivery, reviving and revaluing charity, and reinstating a right of conscience for all practitioners. Now, as an organization, we've done a great deal already. But if I had my druthers, we would be able to do a whole lot more than we do today. I'd like to expand our capacity to act and react. I'd like to build our staff and expand our reach. I have more ideas than you can imagine. Just ask our board. All we need is more money to make it happen. To that end, I'm asking for your financial support. CCHF is a charitable 501c3 educational organization. Your gifts are tax deductible. I'm asking you to write out a check tonight for $50, $100, $500, $5,000, or whatever you would consider the most generous gift that you could give to our organization to make us a powerhouse for health freedom. I'm also asking you to look to the future. Consider adding us to your list of recipients for a legacy gift. We will use education, innovation, and legislative action to move healthcare back to freedom, free markets, and the ethically sound, patient-centered mission of medicine. I'm asking you tonight to help us make it happen. Your gift will sustain and build our efforts. Freedom is at stake. Patient lives hang in the balance. The mission of medicine is under fire. Your gift tonight will support us as we work to reshape and retake healthcare for the future and for freedom. Today is the day I'm asking you to help us make it happen. Thank you for what you've done already. Thank you for what you're going to do. Thank you for being a support to our organization. Thank you. Thank you.